How many times have you heard the phrase, health is wealth? More than we can count on our fingers. But after living through a pandemic, that phrase has taken on a whole new meaning. It's no longer just about avoiding junk food or hitting the gym. It's about having a healthcare system that can take care of us when we need it the most. Health has been thrust into the forefront of public discourse since the onset of the COVID-19 pandemic. This global crisis has shown us that healthcare infrastructure encompasses a wide range of measures from effective healthcare delivery to improving the quality of life. While India has achieved significant public health milestones such as the eradication of polio and neonatal tetanus, universal healthcare is still a distant dream. With a health expenditure of only 2.1% of GDP, India lags behind all other G20 nations, and its healthcare system is largely financed out of pocket by the citizens. Let's take a closer look at the relevant factors that dominate India's healthcare system. Neglected infrastructure. India's health infrastructure faces several challenges, including a shortage of trained medical professionals and a stark rural-urban divide. India has one of the smallest doctor-to-population and nurse-to-population ratios, indicating a lack of trained medical professionals to serve the population. For every 10,000 people, India has only 7.27 doctors, which is below the World Health Organization's recommended minimum of 10. The progress on health infrastructure has been uneven, with 82% shortfall in pediatricians and 80% of general physicians in rural community health centers. Additionally, what's even more alarming is that fewer than the half of primary health centers function round the clock, further highlighting the deficiencies in India's health infrastructure. Organ scarcity. Another factor leading to poor health infrastructure is that the organ donation rates in India remain low, with only 15,561 organ transplants performed last year, despite 49,745 Indians still waiting for an organ replacement. The country has an organ donation rate of about 0.52 per million population, while Spain leads the world with close to 47 donors per million population. Kerala, Delhi and Maharashtra have the most organ pledges, with Kerala leading the number with 130,992 pledges. Antimicrobial resistance threat. Apart from this, antimicrobial resistance, that is AMR, poses a significant threat to public health, and India has one of the highest burdens of infections driven by such resistance. Several bacteria, viruses, and fungi are no longer responding to the existing medicines, making infections harder to treat. Only 43% of pneumonia samples containing one particular pathogen in India could be treated with the first line of antibiotics in the year 2021, compared to 65% in 2016. A similar trend was seen in E. coli infections. Tackling this threat requires investments in new class antibiotics, but India has been falling woefully short. Moreover, little data is available on the funding allocated to AMR research. Vaccination. Did you know that India's immunization program successfully vaccinates around 26.7 million newborns and 29 million pregnant women annually? India's well-established vaccine infrastructure enabled the country to produce, administer, and export COVID-19 vaccines rapidly. A study published in Lancet even showed that India's immunization program helped prevent over 4.2 million deaths in the country. Government's role. Did you know that around 63% of all health expenses in India are borne out of pocket by households? This puts an enormous burden on families, especially in a country where poverty is still prevalent. Thankfully, the government has launched several health insurance schemes to help alleviate this burden. One of the most significant of these schemes is Ayushman Bharat, which was launched in the year 2018. It has already registered over 370 million users and has provided financial assistance for 43.4 million hospital admissions worth 51,749 crore rupees. Despite its success, Ayushman Bharat still faces some challenges in its implementation. One major issue is the underutilization of allocated funds. Additionally, the concentration of health services in urban areas, the lack of awareness about the scheme, and the growing population are also significant roadblocks. Overall, Ayushman Bharat has been a critical step in making healthcare more accessible and affordable for millions of Indians. As the country continues to grow and face new challenges, it's essential to invest in a robust healthcare system that can cater to the needs of every citizen.